lost your attention. I'm running out your mind. Don't know the direction to.
We chose this surgery because removing additions can cause new additions to form, and we put it in the 8th place because complications are not very common.
Next in our list, we have appendectomy, or the appendix removal operation. As we know, the appendix is a small pouch connected to the large intestine on the lower right area of the stomach. If the appendix gets infected, it turns into appendicitis, and it requires an appendectomy. When it comes to emergency surgery, the mortality rate is 5.1 per 1,000 people, according to Medical News Today. On the other hand, complications of either an open or a laparoscopic appendectomy include bleeding, infection in the one side, redness, and swelling in the belly that can occur if the appendix bursts during the procedure. Also, it can cause blocked bowels and injury to surrounding organs. Due to all the symptoms and all the post-operation problems it gets, this is why we added this difficult operation to our top 10. On number 6, we have the laparotomy, or the abdominal surgery. The abdominal surgery may be performed to remove an appendix or repair a hernia. This type of surgery is often performed if serious or long-term abdominal problems have yet to be solved. A laparotomy is not as common as it used to be due to advances in technology, but it can still occur in emergency situations. Complications of this surgery can include bleeding, infection, an incision that doesn't heal well, injury to the bowels or other organs. And serious complications may be accompanied with a fever, increase in pain, incision infection, shortness of breath, and more. Actually, a study of 4,346 patients who had emergency abdominal surgery found that nearly 1 in 5 patients died after an emergency laparotomy, and the overall death rate within the 24 hours of surgery was 21%. As you see, death rates aren't as low as we would like to, and that shows how difficult this procedure is, and that is why it is part of these top operations.
Craniectomy is a neurosurgical procedure that involves removing a portion of the skull in order to relieve pressure on the underlying brain. It's a challenging surgery that is often associated with high mortality and morbidity. The mortality rate can be as high as 60% to 84.6% in traumatic brain injury cases with brain herniation. We chose craniectomy because the steps of the surgery are very difficult, and even if it's done correctly, it can lead to bad consequences.
In the number 4, we have the conjoined twins. This happens when the twins are fused together in utero and remain that way after they are born. Generally, 25% of these children live long enough to undergo surgery. Those who share vital organs typically can't be separated, as it would cause one or both them to die. Complications can include organ failure, skin defects, infections, bleeding, and injury to internal organs. In addition, sometimes surgeons are unable to finish the surgery. Study claims that only 60% of surgically separated cases survive, according to the National Center of Biotechnology information. In the number 3, we have the gastric bypass. Some people who want to lose weight and struggle with diet and exercise seek a surgical solution known as gastric bypass. Patients can lose 50% or more of their body weight afterwards. According to University of Iowa hospitals and clinics, rapid weight loss following the surgery can cause the following symptoms within 3 to 6 months: body aches, hair thinning or loss, or mood changes.
For number 2, we've got vertebral osteomyelitis. This is an infection that involves the spine and the vertebrae, and what it makes it so difficult to treat is, firstly, it's an infection, so it tends to spread a lot, and secondly, it's in the spine, so you might have to replace the entire spine of one person or remove an infected bone of the same person. But the spine is one of the key parts of the human, and it has a lot of nervous And so it makes it super difficult and hard, and that's why it only has like a 20% mortality rate. At last, we've got coronary revascularization. So you get this surgery because your blood vessels are blocked. So what you need to do is insert a metal mesh tube to expand those vessels. This is super hard because we're talking about our heart and it will be pumping a lot of blood. You have to be super careful and really make sure you don't have any long lasting consequences to your health.